First off, thank you for having me. Both my children were delivered by advanced practice nurse midwives, and I've been seeing advanced practice nurses for my primary care since I was in my mid-20s. So I'm definitely a fan, and I'm honored to be with you today presenting on this really important subject. I'm going to tell you a little bit about myself and why I care about this subject. These are my two sons, my husband, and we love to go to national parks and hike. And starting in early 2000s, I started noticing a lot of dead trees in northern Arizona. And then I started seeing more and more in all the places we were going. And I thought, what is happening to the trees? And as I learned more about it, climate change is impacting them in a few different ways. First off, bark beetles that can kill trees weren't dying off in our warm winters. As well, they reproduce more rapidly in our warm summers. Climate change is impacting our water cycles, and so we're getting less rain in the interior West. So they were getting less access to water in multiple ways. And these trees are stressed from high temperatures, and they can't protect themselves with sap because they don't have enough water. So more and more dying trees. As I learned more about climate change, though, I began to understand it wasn't just hurting the places that I loved, it's also hurting the people that I care about, including the populations that I served as a public health nurse. Now, I'm going to be talking about population health today, and a couple of the things I love about population health is that we can choose the population that we're going to focus on. We could look at our entire nation, we can look at specific demographics, we can look at specific groups like pregnant women and children, the groups I served. But we don't just look at how they're doing overall, we can look at how outcomes are distributed within those groups. So we focus on prevention, but we can look at things like access to care, the environment, what are the risks, and what are those health disparities. And what that has helped us understand is our zip code, where we live, is a huge predictor for our health. And it's because of these things that I'm sure you're all familiar with, the social determinants of health. It's access to quality health care, quality education, economic stability, social and community, and our neighborhoods, our built environments really make a difference to our health. And the reason I'm here today to talk about climate change is because it is impacting all of those social determinants of health. We're seeing increasing food insecurity, housing instability, poverty. We know that climate change is disproportionately impacting our most vulnerable communities. And that's why in 2021, over 200 medical journals simultaneously published an editorial urging action to reduce warming, calling it the greatest threat to global public health. Just last month, the American Nurses Association issued a statement calling all of us nurses to climate action. So today, I'm going to be talking about some really big subjects very briefly, but I hope that by the time I'm done, you will understand why climate change is so important to us as nurses, and hopefully understand what some of the solutions are and ways that we can help. So I'm going to start with climate communication, and if you do nothing else, I hope that you will understand why it's so important that we talk about climate change and climate solutions. Because here in the US, there's a myth of indifference, that there are very few of us, or we're a minority who care about these two things. And in reality, research shows very clearly we're actually a supermajority, but we're largely silent. And this paper kind of provides a great analogy of why that's important. If you were in a room with 9 strangers and you were hot and you wanted to open a window and you looked around and maybe 3 people looked like they might be warm, would you do anything? Probably not. If you looked around and there were 6 people that looked like they might be warm, you're more likely, right? But what if 6 people were talking about how warm it was, how hot they were in the room? Now it becomes obvious we should take action. And this is true also of climate change, so we need to be talking about it. Now, Dr. Ed Maybach of George Mason University is kind of a guru of climate communication. He and his team, their research shows there's 2 guiding principles that are really important when it comes to trying to help people make health changes, including climate change. We need simple, clear messages, repeated often, by a variety of trusted sources. And that's also why I'm here today talking to you, because we as healthcare professionals, but especially as nurses, we are trusted sources, and we need our trusted voices in this critical health issue. second guiding principle they found is that we need to make the behaviors we're promoting easy, fun, and popular. And I'm going to talk more about that when I talk about solutions. They also came up with this 10-word summary of climate change. And that is, it's real, it's us, experts agree, it's bad, and there's hope. And I will talk about these more as I go along as well. So let's start with climate science basics. It's important that we're all studying on the same page. And what you see here is our Earth's natural carbon cycling. And to me, it kind of reminds me of when we monitor respirations in a person. And that's appropriate because these represent an exchange of gases. These higher peaks are where CO2 levels are higher in our atmosphere. And these valleys are when CO2 levels are lower. They're stored in the ground, in our forests, in our oceans. And you see this nice natural carbon cycling in this ideal kind of area that's nice for us human beings. And then in the late 1800s, you see this tremendous change. If you know your history, you know that is when we began the Industrial Revolution. And it's when we humans started taking that stored carbon in the form of coal, gas, and oil, and we began to burn it and rapidly release that CO2 into our atmosphere to do things like make all the things, transport them all over the place, make our electricity. We also, around that same time, started taking limestone that also stores CO2 for long periods of time, and we began to make cement with it, which rapidly releases that CO2 into our atmosphere. Now, in 1800, there were about 1 billion people on our planet. Today, there's over 8 billion. So now you have over 8 billion people doing that same, pulling that CO2 where it's stored and rapidly releasing it into our atmosphere. At the same time, we have been destroying things like rainforests and wetlands that would normally draw down some of that CO2 and store it, to do things like build more and more houses, bigger houses, to grow more food for those 8 billion people, and to grow more food for the meat that we're all eating more and more of. We also changed the way we grow our food in that time period. We used to have smaller farms with more diversity, and they had healthy root systems and a healthy soil microbiome, and that actually helps draw down some of that CO2. Now we're using petrochemical fertilizers, pesticides, herbicides, and we're essentially killing that soil microbiome. So we're not getting the sequestering, and a lot of those chemicals are actually released as greenhouse gases into the atmosphere. We also globalized. We are now moving people, our food, all the things we buy all around our planet in a very carbon intensive way. It's us. We're definitely changing our carbon cycles. And so why is all that extra CO2? Why does that matter? Well, you can do a very simple grade school experiment. You can put CO2 in one bottle, regular air in another, shine heat lamps on it, and take the temperature, and you'll see the CO2 bottle the temperature goes up rapidly and it stays warmer. We're doing that same fun experiment on a planetary level by rapidly increasing heat trapping gases like CO2 and other greenhouse gases like methane, which actually trap 80 times as much heat as CO2 over a short period of time. As those temperatures go up, warm air actually holds more water, and unfortunately, water also traps heat. It's also one of the reasons we're seeing more severe rainfall and snowfall as our temperatures go up. So these are the ways that we humans are increasing greenhouse gases when we produce electricity with fossil fuels, the food we eat, the food we waste, how we grow it, how we use land, industries such as when we create cement and refrigerants, transportation, buildings, and other is a lot of processes related to the fossil fuel industry. But we also have many solutions, and many of them are cheaper and better for our health. And I'll highlight some of those as I go along. So since the late 1800s, we have increased our temperatures by about 1.2 degrees Celsius our global averages. It doesn't sound like a lot, but it's important to understand that we're doing those changes in temperature. It's a very rapid change in comparison to the past, and plants and animals need time to adapt. As well, producing food, raising livestock, those processes require an ideal temperature range. And as our temperatures go up, we're creating more areas where we're beyond those ideal temperatures, and that's only going to increase. It will be hard to feed over 8 billion people as we do that. As well, there's many other impacts. We're seeing climate breakdown in the form of more wildfires, drought, flooding, heat events. These are all right here in Arizona, but if you're watching the news, you know these are happening on a global scale. And I think it's important to note that climate change doesn't necessarily create brand new things. We've always had these things. What it does is increase the frequency of them and the severity of them. It's real. As nurses, we need to be evidence-based, and I want you to know the evidence is overwhelming. When you look at peer-reviewed scientific papers, we humans are causing climate change. As well, the Intergovernmental Panel on Climate Change, the IPCC, consists of hundreds of scientific experts reviewing and summarizing thousands and thousands of papers. And what that evidence tells us is climate change is harming our health right now. Everyone is affected, but some people are more vulnerable. And most importantly, if we do nothing, these health threats will increase. Experts agree. So there's scientific consensus. Why is there doubt about the evidence? If you worked in healthcare at all, you know that we have a problem with disinformation. And when it comes to climate change, we have a fossil fuel industry that's among the wealthiest industries on the planet, and they don't want to leave their profits in the ground. So they're putting a lot of money behind disinformation to create doubt, denial, and delay action on climate change. And that is another reason our trusted voices are needed to help dispel disinformation. So who's most affected and why? These three things help us identify who that is. And just to give an example with heat, exposure is, anyone who lives outside, works outside, plays outside. If someone is pregnant, if they're really young, if they're elderly, or they have chronic illness or conditions, they may be more sensitive. And ability to adapt, an example is if I'm unhoused, it's really hard for me to adapt to increasing temperatures to get myself out of there. So using those three things, we can identify which populations are being impacted first and worst by climate change. And if you work in healthcare, you are working with at least one, probably multiple populations here. And as a maternal child health nurse, I worked with children and pregnant women, so I'm going to highlight those examples throughout. It's bad. So again, informed decision-making is important to us as nurses. So what happens if we continue as usual or make small, slow changes to our emissions? This is the IPCC. They say we'll miss a brief and rapidly closing window of opportunity to secure a livable and sustainable future for all. That's really nice academic speak to say a whole lot of people will die if we don't take rapid action. And I think it's important to understand there are unknown unknowns. We don't know at what point in our emissions and increasing temperatures we're going to drive mass extinction events or human mass mortality and morbidity and other climate-triggered risk cascades. And my question is, why are we gambling when we have such high stakes and we have cheap, effective solutions? So those are unknown unknowns, but we know that our health is already being impacted by climate change, so let's talk about that. I'm going to use pieces of a patient handout from the Medical Society Consortium on Climate and Health, and I like it because it's an acronym that I can remember some of the main ways, not all of them, but some of the major ways our health is being impacted by climate change. Now, they mentioned food disruption in our food supply, but that's so important, especially for pregnant women and children, that I think it deserves being part of the acronym, so I added that in. So let's start with heat illness. So if you spend any time in Arizona, you can probably think of some of the populations that are most impacted. I'm going to highlight inequities. And here you have three maps of the Metro Phoenix area, and this one on the left in blue shows our high areas of childhood poverty. Now, we can make maps like this of cities all across the US, and what we find is these areas of poverty tend to be areas that historically were redlined, and experience other racist and unfair policies. And we know that these same areas tend to be areas with high amounts of people of color. And these impacts are continuing to be unfair today because these same areas are areas we don't invest in green spaces. So we have low tree canopy, and these same areas then experience higher temperatures, heat island impacts. So they have a higher heat burden. Those same areas also tend to be the areas where we have poorly built homes and inefficient equipment, and their energy cost per square foot is just higher. And here, a broken air conditioning can mean a death sentence. So what's really great about identifying those inequities is that we can then turn them into opportunities to build resilience. So as an example, this is Maricopa County, and these are the counties where we know indoor heat deaths are high. 85009, that was the zip code, one of the zip codes I lived in as a child. So we know where that's happening, and there's funding already to do things like replace air conditioners for low-income individuals. Let's make sure we're replacing them with high-efficiency heat pumps that can also be used during the winter instead of fossil fuels. Let's make sure we're doing weatherization in those neighborhoods where it's most needed. Let's invest in green spaces and cool roofs and cool pavement in those neighborhoods that have higher heat burden, heat island impacts. Those are adaptations though, and it's important to understand that if we keep on emitting greenhouse gases, we are going to keep on increasing our average temperatures. And with that, you see what was a smaller amount of hot weather, we are going to experience increasing amounts, and we're going to add to that more extreme temperatures as well. And if we continue to increase our temperatures and our emissions and our temperatures, we're going to get to a point where it's difficult for people to survive. As an example, we will experience more extreme heat events, and a study was done looking at what would happen if Phoenix experienced a multi-day heat wave and had electric grid failure. Half of Phoenix residents, because it's so hot here, would need urgent medical attention, and many would die. So we have to first address the cause of warming. We must reduce heat trapping emissions. So what does that mean, reduce emissions? Well, this is a simple summary by Dr. Catherine Hayhoe, a climate scientist, of the IPCC report that tells us what we need to do. And that is, we need to build massive amounts of now cheap renewables. We need to electrify everything we can to run on that. And then we need to implement conservation and efficiency everywhere we can, and invest in nature, those places and spaces that help draw down some of the carbon. And finally, we have to research the last hard stuff. We also can learn from each other. There are places that have already experienced extreme heat events. There were things that went well and things that did not. So let's learn from each other and make sure we're more prepared, because we are going to experience these kinds of events. All right, exacerbate heart and lung conditions. So burning fossil fuels not only increases our global temperatures, but they produce so many toxic air pollutants, and all of them impact our health in negative ways. Just one example, when they closed the big coal plant in Pittsburgh in 2016, they had near instant decreases in heart-related emergency department visits and hospitalizations for cardiovascular diseases. And those impacts persisted for years for the duration of that study. And we have other research, many other studies that show that air pollution correlates with so many health outcomes across the lifetime, not just our heart and lungs as adults, but things like preterm birth, prenatally, in children, more childhood asthma, harm to brain development, in our elderly, dementia. Fossil fuels are not good for our health. Now, climate change also impacts our air quality. When temperatures are higher, it actually speeds up ozone production. And ozone is kind of like a sunburn to the lungs. And so we see both short and long-term exposure impacts from them. We also are seeing increasing wildfire, and that wildfire smoke not only causes heart attacks, strokes, and respiratory exacerbations, but it's also particularly harmful for children 0 to 5 years of age. Who else is most affected? Again, there's that poverty connection. In poor neighborhoods, we've got, sometimes they're 14 degrees warmer, so we have more ozone formation. We also have unfair situation where we put polluting industry, power plants, highways, and truck routes in those neighborhoods. Oftentimes, there are more people who walk and wait along roadways for public transportation, and they often also have terrible indoor pollution from using things like gas ovens, coal, and wood burning in their home for heat. Again, we can turn those inequities into opportunities. There's funding to electrify our school buses. Let's make sure we're doing that in the neighborhoods that have the highest air pollution. Let's make sure that we're converting to clean solar energy. Let's make sure we're investing in green spaces that can help cool down some of that air pollution. All right, asthma. Again, air pollution is a big deal, and Phoenix and many counties in Arizona are not doing a good job with our air quality. And again, children are especially vulnerable because they play outside and their lungs are developing, and prenatally, their whole bodies are developing. And again, there's that poverty connection. We see these kinds of maps all across the US when people take the time to produce them. Where there's poverty, there's childhood asthma, and it's because of that indoor and outdoor poor air quality. Climate and fossil fuels also impact health directly because we now know that it sensitizes cells to allergic reactions. Also, those higher temperatures increase that air pollution, as I shared. That extra wildfire smoke has an impact. Dust particles from dry soils, which also impacts valley fever rates as well. Allergens I'll talk about in a moment, but all of these things mean that we have increased childhood asthma and more asthma exacerbations on those hotter and higher pollution days, especially in our communities that have a higher burden. And don't forget indoor air quality. We spend most of our time indoors, and some indoor air is 2 to 5 times as much pollution, sometimes as much as 100 times. Again, there are things we can do. We can advocate for more walkable, bikeable cities, that active transportation that's so good for us anyway. We can incentivize lower carbon options like e-bikes, which again are also good for us. We can electrify our transportation. We can clean and green our energy. We can also improve our indoor air too by converting from gas stoves to electric options. We can improve our air ventilation and watch what kind of chemicals we're using to clean with. We can help our patients know about allergy forecasts and airnow.gov so that they know what days they should maybe limit their outdoor activities. If you're a prescriber, are your insurance and drug formularies updated to the current asthma and COPD guidelines? Because dry powder inhalers are preferred because metered dose inhalers actually release greenhouse gases. Let's not contribute to the health problem we're trying to treat, right? Traumatic injuries. If you're watching the news, you know we're having more frequent, more severe climate disasters. And it's not because you're paying more attention. It's not because we're covering it more. We are seeing an increase every year as our temperatures warm. And it's impacting our most critical infrastructure like hospitals and our most vulnerable populations. Again, children are especially vulnerable because they have more years to live with those growing number of climate disasters. They rely on adults to keep them safe. And when their families lose home or work, it's children who sometimes have to go to work instead of returning to education. They may be at increased risk for early marriages, domestic violence, and exploitation. They may become separated from parents when those disasters happen, or even lose parents. Again, what can we do? We can make sure that we're doing better emergency management planning, and we're thinking about our vulnerable populations. For example, are we making sure that we have off-grid backup power options for those who need electricity to stay safe during a blackout? Otherwise, they can overwhelm our hospitals. We can do programs like this one in Minnesota, Lawns to Legumes, where they provide small grants to homeowners to switch from turf grass to native plants. And what we see here is a richer root system and a soil microbiome that can help sequester carbon. We don't use the chemicals that we use with turf grass. Less water is required. We can reduce our flood risk because it absorbs more water, and it protects our water from those chemicals and supports biodiversity like our pollinators that we need for our food. And what's great about that program is that it is beautiful, it's good for our mental and physical health. So food and waterborne illnesses, let me see, I'm sorry, I've got to make you smaller, but I'll try to keep Grace online so I can see you. And water and foodborne illness and water and food shortage impact. So as predicted, our water cycles are impacted. We're seeing hotter, drier conditions in interior west and hotter, wetter conditions in the northeast and our coast. And so all of those impact our fresh water, our clean water. And so we're seeing more waterborne illness. And those higher temperatures mean more bacterial growth in our food, so more foodborne illness. And all of that, those harmful chemicals being flushed into our waterways, plus high temperatures mean more harmful algae blooms, and that impacts our food webs and us too. We also know drought is impacting the Colorado River, and even though we had a wetter winter this year, the gap between water flow and demand is enormous, and it's likely to widen. And it's not just the Colorado River, it's the Mississippi River near where I live now, and it's many major rivers all across our planet. It's not just our rivers, it's also our falling groundwater levels. This is a map of the US. And so those changing water cycles and those higher temperatures and more severe weather all means loss of food crops, loss of livestock. We're having a harder time moving food from where it's grown to where it's feeded. And those higher CO2 levels and temperatures, actually the crops, from research we know, they're less nutritious. As well, our farm workers are being impacted, and higher CO2 levels mean more acidic oceans, and that means more impacts to our food webs in the ocean as well, including the higher temperatures. All of that means less food and more costly food. And so even in places in America where we have food safety nets, children go hungry and more children will go hungry. But in places that are experiencing war, conflict, disease, corruption, and have already been experiencing more severe climate impacts, we will see more famine, and children 0 to 5 are especially vulnerable. Some of the things we can do is reduce food waste, because that's just carbon being unused. We can switch to more plant-rich diets that are less carbon intense. And we can do innovative things like family planning and educating girls. That actually changes the population trajectory. And all of these things are also good for our health. We can go back to growing food in a way that supports, protects our water, protects people, protects biodiversity. We can do things like use water more effectively and efficiently, use less thirsty crops, and improve our soil health for some of those reasons I've already mentioned. We can also improve our food security by protecting food producers from increasing climate risk. They shouldn't carry that risk alone. And we need to protect food workers, especially those who are least empowered. We can diversify where we grow our food by encouraging community gardens that also build community and they increase nutrition in the areas where it's most needed. So allergies, allergenic plants aren't dying off either, and we have a longer, more severe allergy season. Higher CO2s and temperature mean each plant produces more pollen and a higher allergenic content. And when you add air pollution, it's a 1-2 punch. Some of the things we can do is improve air quality, both indoor and outdoor, and monitor allergens and adjust activities. So what creature kills more humans than any other? You probably know it's the mosquito. Let's talk briefly about vector-borne diseases, a little bit about zoonotics. So vectors like mosquitoes, sandflies, and ticks carry these vector-borne diseases, and we are seeing increasing number of these diseases and in new areas, right? And why is that climate related? Because many things about how many mosquitoes there are, how many ticks there are is very temperature dependent. As well, we know temperature changes can mean vectors moving into new environments. There can be a different species that actually carries a different disease. And those new areas have less immunity, and they may have healthcare providers that aren't aware that things have changed. And how we prevent them may have changed as well. Now, we're also driving habitat loss, and habitat loss to deforestation, agriculture. This not only impacts vector-borne diseases, but also zoonotic diseases, because it changes the interactions between those parasites, vectors, and hosts. And so we expect to see more zoonotic diseases like coronavirus if we continue to destroy habitat. Some of the things we can do is monitor for vectors so that we know what's in our area and that we're taking appropriate avoidance measures and disease treatment. We can get rid of man-made breeding sites. And most importantly, let's protect the natural habitats and biodiversity that naturally reduces disease risk. You may not be aware, but Indigenous people represent about 5 to 6% of the global population, but they've actually protected 80% of biodiversity that's left in the world. So supporting Indigenous land rights is good for all of us. Emotional stress. So it can be ongoing anxiety and depression about climate change, or it can be acute traumatic experiences during and after disasters, or it can be because of climate migration. People are losing their homes, community, family members, their identity. So if a farmer loses their farm, are they still a farmer? And they often experience racism and discrimination when they go to new places. We see that here in the US when people try to come here. And so more people are experiencing it, not just in the US, but all across the planet. And farmers and ag workers actually have one of the highest suicide rates. And that's not just a problem in the US, we see that globally. We especially see it after flooding, drought, and extreme heat events where they lose their crops. And again, children are especially vulnerable for some of the same reasons I pointed out earlier. Now, this youth survey of 10,000 16 to 24-year-olds shows some pretty concerning concerns about their future. And they feel that we've betrayed them, we've failed to take care of the planet, and really we have. So some of the things we can do is help them understand that we are aware of the problem and we're working on it. And let's actually do that. And we can also ensure that we're providing appropriate mental health services that target those highest risk populations. And let's try to find ways to build social networks where everyone can also be part of the solution. So we could do that around climate resiliency. So things like those community gardens, but also things like the American Climate Corps, a new program where we're going to pay people to work on climate solutions. So I hope you can see that all of these social determinants of health are being impacted, but also that there's hope, that we have effective solutions. And I think it's important to understand that healthcare actually contributes 8% of US emissions. So we have a choice. We can contribute a lot to the harm, or we can be a big part of the solution. The Department of Health and Human Services actually provides free tools, funding, and information in this free webinar series so we know how we can contribute to the solution. This is just one example. It's some decarbonization strategies. It includes things like transportation and building, but things specific to our industry like anesthetic gases. There's some that trap a lot of heat and others that don't, that are just as effective. We also need to support system actions because those are things that make individual action easier. So things like transportation, someone might take mass transit or a bike to work, but if we make mass transit cheaper and more frequent or more available and safe bike lanes, then we make the individual choice the easy, fun, and popular choice, right? So climate change impacts our health, but climate solutions are often health solutions. Many of the things I've highlighted, clean energy, active transportation, plant-based diets, green spaces, these are all good for our health too. As individuals, some of the most important things we can do is vote for candidates to understand how important it is and talk about it. Let's help dispel the myth. And these are some of the people we need to be talking to, especially our employers and legislators. They also may believe that myth that not very many people care about it. I'll also be giving Molly some slides that help you to know how to talk about with patients quickly and easily. We need to find solutions that work for everyone, and there are so many great ones that are also good for our health. And if you want to join us, other health professionals who are working on these issues together. You can join Arizona Health Professionals for Climate Action, or you could join the Arizona Nurses Association Climate Change and Health Work Group. And I will leave you with this quote from Ms. Amanda Gorman, and I'll take questions.
Thank you so much, Rhonda, for all that information. I really appreciate you having that heat map of the Metro Phoenix. I thought that was a really great visual for us to really identify, the areas of poverty and how that really impacts how climate change can impact them as well.
And there's similar maps like that that show high pollution in those same areas. Like all those fire zip codes are so important. We see those high asthma rates, it all correlates. So
I really like too when you are with one of the concluding slides, just talking about how all these things that are good for the planet are good for us too. Like it seems like these solutions are.
It's a natural fit for us, right? The things that we already know are good for us are actually good for climate change as well. So it makes it a natural fit. Thanks, Molly. Did we have any questions in the chat? I know I could probably look at it, but it's easier if you guys, or if someone wants to come off mute and ask themselves.
Is there any? Oh, go ahead.
My question, well, I just have a question about the increasing heat. So the American Academy of Pediatricians recommends that newborns be kept at about 68 to 72 degrees. With the increasing heat and variables in temperature, do you think it's a sustainable recommendation for a lot of newborn infants?
I didn't hear totally keep what at those temperatures?
Yeah, so are you able to hear? Hello?
Yes, I heard you, but it was kind of a little garbled.
Oh, sorry. So since there's a lot of variables in the temperature inside Phoenix, given that the American Academy of Pediatrics recommends that the room temperature for newborns be about 68 to 72 degrees, do you think that it's sustainable to keep that recommendation, especially with our temperature variables?
So for newborns, is that what you said? The ideal temperature for newborns, is that what you were saying?
Yes. The room temperature.
Yeah. So are you talking about in the hospital, or are you talking about at home?
At home.
Or both? Yeah. So that's a great question. And I think the reality is we know there's recommendations, and then we know what actually happens in our communities. And our communities where the heat burden is higher, they're having to choose between eating and paying rent and buying food, or cooling in this case. So it's a heat or eat correlation. And so we can give recommendations, but if they're having to choose between being able to pay their rent or being able to pay their bills, sometimes they're not able to do that. And so regardless of what we recommend, if we don't help people to reduce those burdens, the unfair burden where we have homes that are just really difficult to keep cool, we're going to continue to have people, regardless of what our recommendations are, follow those recommendations. I think we know that very young, very old, the elderly, they are more vulnerable to temperature changes. So, that's why those recommendations are probably there, because we know that otherwise they may not do as well. So we need to figure out ways to help keep people safe.
Yeah, that's a good answer, Rhonda. Because rather the emphasis has to be put on the systems and structures and policies that we're living in that are supporting increasing heat in our atmosphere and in our environment, and so that changing the recommendation is not the solution. The solution is first and foremost educating people that are in the position of policy making and people that are fighting and denying climate change and the effect that we're having on people, real people, and that getting them to be educated to know that that's the recommendation, that the temperature in the home is ideal for infants. We're talking about babies here now that can't defend themselves. And what are we doing to make it so that families don't have to make that choice between food and cooling and paying their rent? And landlords provide adequate cooling systems until we get to a point where we are starting to make inroads into the changes in the climate that are creating these problems. It's like blaming the victim, I need to be careful about our language too, that, we're being encouraged by the fossil fuel industries to lower our carbon footprint. No, you need to change your behaviors as far as digging that stuff out of the ground and investing more yourself. You can take those dollars that you're investing in drilling oil, and Arizona could be the Saudi Arabia of solar power if we had the will to do it.
Yes. I say we could be the solar titans. That's what I agree. And it's funny, the carbon footprint was actually created by and marketed by BP, which is a major fuel producer. So
right. I am aware of that. Yes.
So,
yes.
It was definitely individual change makes a difference because, for one thing, it makes us feel better. It encourages others to take similar actions. But the reality is, we need system change. We need industries to do what needs to happen, including the healthcare industry. So, we need big system changes are important, and that's why we need to be talking to our elected leaders, because that's where some of those changes need to happen that make it easier for individuals to do the right thing.
And as people on the inside of the healthcare industry, we have a powerful voice within the places where we practice. I was participated in a webinar not too long ago where there was someone from Kaiser Permanente spoke, and they have a sustainability, CEO or something, person that's in charge of that. And they were able to enact major changes in purchasing within the entire Kaiser Permanente system. And because they were able to show the system how they could save money. And if that's what it takes, that's what it takes. And we also are powerful drivers.
And the reality is,
we're also powerful drivers of the choices that the industry that provides us with the supplies, that what they make in terms of what they produce to sell. If the hospitals will become big buyers of items that are sustainable or reusable or biodegradable, trust me, they will make them because they can make a buck on it.
That is the irony. There's so much research showing that when we do these changes that are good for our climate, we actually often save money. We save, they're money savings. So, but if we're not careful, there is a lot of disinformation and misinformation out there that's trying to keep us from taking those actions. Like, it's going to be terrible if we do these things. But the reality is, one of my favorite climate advocates talks about, we have a choice between Armageddon and awesome. Let's choose awesome. There's a lot of things that will be great. If we had a more walkable, bikeable city, I know it's harder in Phoenix, especially in the summer, that's kind of different, but there probably has to be location-specific solutions. But in many places, how awesome is that to be able to have cities that are built in a way where the things we need are close and we're not having to drive far to get to them. they're more walkable and bikeable, doing those things that are healthy for us anyway. So.
Thank you so much, Rhonda, and your team for sharing. We really appreciate it. Right now it's around 8:30. So are there any last minute questions that anyone has? All right. Well,
Thank
if
you
you
for
guys take
having
a
me, Grace. I really appreciate you giving us the time to come and provide this presentation.
Well, absolutely. Thank you for coming over and giving us plentiful information and along with those resources as well. So our members, if you guys had the chance, take a look at the meeting chat. Pat provided some wonderful resources, and Molly will also be putting in some stuff in Canvas as well. So I want to thank you all to attending tonight, and special thanks to Rhonda and your team for joining us tonight. I really appreciate it, and hope to have you back in the next time too. It's great information. Thank you again. All right. Thank you so much, everyone. Have a wonderful
everyone
rest
for
of
attending.
your... Yes.
Thank you very much, guys.
Thank you.